Hi, my name is Chelsea and today I'm going to be performing the trach care. I have my scrubs on, the appropriate attire. I also have my badge here. I don't have any jewelry and no nail polish or anything like that. So first thing I want to go over is that normally this would be done with two people, one stabilizing the trach while I perform the trach care. So I would ensure that the patient is in semi-Fowler's or high Fowler's position, maintain privacy. Of course, that was done at the beginning, whether it's drawing the curtain or closing the door and just doing my introductions. So first I'm going to perform my hand hygiene. I have just my clean gloves here. I have my trach tray here, and I'm just going to peel away. I have the sterile gloves here, and then this right here is where we're going to be setting down all of our supplies to clean the trach. And we want to ensure that we put the shiny side down and maintain, keep our hands on the outside and also keep that 1 inch margin. So I'm gonna go ahead and do that. Set that down there. And I'm going to dump all my supplies. And right here in these two would be the normal saline and then the hydrogen peroxide mixed with the normal saline. Now I'm going to go ahead, perform my hand hygiene again, put on my clean gloves. Suctioning should have been done if it needed to be done. And then now what I'm going to do is I want to pull out the cannula. So I'm going to unlock it here and ensure that it maintains its curvature, and it does. Dump that in the hydrogen peroxide and let that sit, and then we're going to get ready to clean. So now what I'm going to do is I'm going to remove these gloves. We're going to dispose that. Then I'm going to grab my sterile gloves. I have them right here. Again, we want to make sure that we're just touching the outside here. There's flaps for me to open. Have my non-dominant hand here on the outside cuff. Got that on. Now I'm going to go ahead and do the other one. Grab the cuff and pull the gloves on. Then I would grab the inside of this and then I would dump it. So I'm going to go ahead and dump that. Now the next thing that we are going to do is we're going to go ahead and clean the cannula. So I'm going to grab, oops, stuck here. I apologize, the brush was stuck. But we're going to go ahead and clean the cannula. So I'm just cleaning it. Then I'm going to dump the brush and I'm going to put that one in the normal saline. And then now what I'm going to do is I'm going to grab the applicators and I'm going to put them in the other side of the normal saline. And then what I'm going to do now is I'm going to remove the gauze. We're going to toss that. Then now I'm going to put the inner cannula back, make sure the curvature is maintained, locked in place, perfect. And then now what I'm going to do is I'm going to clean and grab those cotton swabs. So just clean around, dump, clean around, dump, clean around the trash. And then what I'm going to do next is grab a gauze just to dry. Just dab away. And then I'm going to now grab the gauze that goes around the trach. Make sure that's secure. Okay. And I'll be doing the one tie method. I did only have one tie in my kit. So normally we would take off the tie, and because I don't have it on, I'm going to go ahead and move forward to now securing the new tie for this trach. I already made my slit initially. So I'm going to go ahead and tie that. I want to make sure it's not too tight, just so that we don't put the patient at risk for like skin breakdown or anything like that. And I do have another gauze here that I'm going to put where I made the tie, just to again ensure that they're not at risk for that skin breakdown. Perfect. So now I'm going to close everything up and we're going to dispose everything. I'm going to remove my gloves and I'm going to perform my hand hygiene again and then document everything that I did and how the patient tolerated it. Thank you.